Hi, my name's Kim, and this is Brittany. We're going to be doing my health assessment video. So, the first thing I'm going to do, hi Brittany, my name's Kim, and I'm going to be conducting your physical assessment today, so let me know if you have any questions throughout the process. Then, wash your hands. Start by inspecting the head, symmetry, inspecting the eyes, external eyes. Should I just have you raise your eyebrows and blink for me? Perfect. Look in your eyes. Sharp disc margins and no other abnormal findings. We're going to look at external ears and also look in the ear at the same time. Seeing a pink auditory canal and a gray tympanic membrane with a cone of light at 5 o'clock. We're going to do the same thing on this side. Now look in the nose. We have normal findings in there. We're going to have you open your mouth. Real quick, stick out your tongue. Stay off. Going to depress the tongue as well. Can you move your tongue from the left to the right? Smile, frown, clench your teeth. Move your jaw from the left to the right. Perfect. Now we're going to move on to palpation. Going to feel the scalp and the head for any sort of abnormalities. Feel the eyelids. Feel the frontal and the maxillary sinuses. Open your mouth. Close it. Move your jaw back and forth. Also going to feel for the lymph nodes. We have a ticklish patient here. It's okay, it happens. And we're also, spread your arms a little bit. I gotta get to your armpits. Feel the axillary lymph nodes. Sorry. Next, standing behind the patient while they're swallowing. Gonna feel for any thyroid tenderness. Pardon my cold hands. Okay. Gonna move on to vision. Gonna test pupillary reaction. Her pupils are equal and reactive to light. I'm going to test for extraocular movement. So I want you to follow my fingers with just your eyes. Okay. Now, I want you to tell me when you can no longer see my fingers. Now, if we had a Snellen chart here, that's the next thing that we would use. So we would stand 20 feet away from it. Brittany would cover one eye at a time, and she would read each line, and then we'd be able to tell what her visual acuity is. Next, we're going to test Brittany's hearing. So, first thing we're going to do, let me explain. You're going to strike this tuning fork. You're going to put it on top of your head, and I want you to tell me if you can hear the sounds equally on both sides. The next thing we're going to do, strike the fork, I'm going to put it behind your ear. Tell me when you stop hearing it, and then I'm going to put it next to your ear, and I want you to tell me again when you stop hearing it. So we're going to do it again on the other side. This is pretty normal that you hear it like twice as long through the air than you do through bone. Same thing. The last thing we have to do is we're going to do some whisper test. So I'm going to whisper in your ear, and I want you to tell me what that number is. 11. 7. Perfect. So now I have a few questions for you. Please tell me your name and the date.
Brittany, October 21st, 2017.
And where are we? You don't have to say the hospital.
We're in North Andover.
Yes. All right, so now we're going to do serial sevens. So I need you to count backwards from 100 by sevens.
So 100, 93, 84, yep, 86, 79, 6, 71, 64, 57, 50.
Okay. Now I'm going to give you 4 words to remember. Let's see. Chicken, car, bucket, orange. So count backwards from 20 by 2.
20, 18, 16, 14, 12, 10, 8, 6, 4, 2.
Now what were those 4 words?
Chicken, car, bucket, orange.
Perfect. Now, can you tell me how you spent your last birthday?
I went out to eat and then we went home and had cake.
Perfect. Now, I want you to take this paper and I want you to do what the instructions say. Gonna check a few reflexes on you. Relax your hand and your arm. I don't know if that was visible, so we're gonna do it again. Was it? No? Okay. Relax it. There we go. I'm just gonna check the patella reflex. Uncross your legs. And normal finding for this would be a 2+ reflex. All right, a couple more questions. You need to close your eyes, stick your hands out with your palms open. I'm going to trace numbers into them, and I want you to tell me what number it is. Okay. Keeping your eyes closed, and I have a few things in your hand, and I want you to tell me what they are. Good identification of the coin. Now this, keep it in that. Perfect. All right, now let's just keep your eyes closed a little bit longer to test sensation. So you're going to feel something that's either sharp, dull, or soft. I want you to tell me which one it is. So we're going to start with your face.
Yeah. That's soft.
Yes.
That's dull. That's dull. That's sharp. That's soft. Do you? Soft. Sharp. Do you? Dull. Sharp. Sharp. Soft. That one's soft. Soft. Do you? Sharp.
Dull. Maybe my tools work.
That is soft. Sharp.
Right. Okay. Can you take your socks off? All right. Keep your eyes closed. I want you to tell me if I am moving your toe up or down.
Up.
Let's actually scoot you back.
Up. Up. Down. Down. Up. Down.
Okay. Now I'm going to do that with your fingers.
Up. Down. 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 Up. Up.
Perfect. Now we're going to do a few movements. So while I have your legs visible, what I need you to do with your hips is take your heels and run them down your opposite shin. Perfect. All right, now put your hands in your lap. I want you to flip them, palms, back of your hand. Great. Now, close your eyes. I want you to take your finger, your index finger, to your nose. Alternate. Perfect. All right, so now I'm going to move on to checking your respiratory status. So first, remember, in a hospital, the patient would probably be in a Johnny, so things might be a little more visible. So we're looking for equal breathing movements and for absence of any sort of like retractions or any sort of like accessory muscle use. We're also going to look from behind. You wouldn't mind spinning around. Great. So you would do the same from behind, looking for even breath. What we're also going to do is feel for chest expansion. So I'm going to take my hands over here. So you can see. You want to make sure your hands are both moving the same way. While we have Brittany's back, we're also going to percuss for CVA tenderness to make sure she's not having any pain in this area. Okay, spin on around. So next we move on to percussion. So when we're dealing with the front, there are 6 spots, 10 in the back. But first, we're going to palpate for fremitus because we want to make sure that we don't feel any unexpected vibration. So 2 spots in the front, 3 in the back. I want you to say 99.
99. 99.
Some people can do it with 2 hands, but it's usually easier to do it with 1. And we're going to do the same thing in the back.
99. 99. 99.
Perfect. Now we're going to percuss. We're going to do it in a way so that we can compare equal sides. And then we'll do it in the back. Spinning. Perfect. So again, we're comparing spots. We're expecting to hear mostly resonance because we are dealing with air-filled structures. While Brittany's back is Jess will also auscultate since we don't want to make her turn. Deep breath. All right, let's spin around if you wouldn't mind. Now we also take deep breath. Now we're going to oscillate in all of the same spots, but this time with Brittany saying 99. See if we hear any abnormal voice transmission.
99, 99, 99, 99, 99, 99.
Then we'll do the same in the back.
99, 99, 99, 99, 99, 99, 99, 99, 99, 99.
Again, we do all these things in the same spots every time. So then a couple other things you want to do when you're assessing someone's respiratory status. You want to check their oxygenation by using an oximeter, which you stick on any finger. Ideally, it's not cold and it doesn't have nail polish on it. So Brittany's oxygenation is 98. Very good. Something else that we can do is spirometry, which is a testing of how well your lungs are working. It shows how much air you get in and then how much and how quickly you can get out. Something else that we can do with Brittany, while we have her here, I forgot to do it before, but I mean it happens. When you're assessing the mouth, you check a gag reflex. So when Brittany was sticking out her tongue, you want to lightly touch the back of her oropharynx. That causes the soft palate to lower and the oropharynx to constrict, and that's what would cause a gag reflex. Now, so we're going to do a little bit of range of motion while we still have Brittany sitting up. So starting at the top, we're going to do the neck. So I want you to look down, look up, look to the left, look to the right, then touch your ears to your shoulders. And then to test strength, I'm going to have you look to the left, look to the right, look down, look back. Perfect. In the same time, we're inspecting neck, making sure things are symmetrical, no abnormal findings. Next, we're going to move on to the shoulders. So I want you to raise them up to the ceiling and now back behind you, and then one across the other. Perfect. And then to test for strength, we'll test her shoulder strength. Perfect. Now we move on to the arms. So I want you to flex, extend, and pretend that you're like lifting up some soup. Down. Okay. Push against. Strong. And go down. We're good. Now onto the hands and the wrist. So you want to point palms to the floor, palms to the ceiling. Point your hands in.
Down.
Yeah, just like that. Point them in. Point them out. Spread your fingers. Grab my hands and hold them as tight as you can without hurting me, please. Okay, perfect. Now move your hands out. Move them in. And we are good. Next, we're going to check the hip. So, I need you to lay back, if you wouldn't mind. I want you to raise your whole leg to the ceiling, both your legs. Down. And if you could roll over onto your stomach. And raise your legs to the ceiling one more time. Perfect. And if you could scooch back a little so your feet are hanging off, I'm going to check the Achilles reflex while I have you in this position. All right. So if you wouldn't mind just sitting up for 1 second while we test this. Like that. I lied. I want you to move your hips out. Spread your legs out. And now one at a time, I want you to cross one leg over the other one. Like that. Keep it straight. Perfect. Now sit up. And just try to raise your legs up. Perfect. Now let me fix the head of this bed before you. Yes. Okay. So if you could scooch back. Promise it's not going to go anywhere. It's going to stay where it should be. All the way back and look that way. We're going to look for jugular vein distension. It really isn't visible in Brittany, but if it were visible, you would want the distance from the sternal angle to be less than 4 centimeters. So Brittany, if you wouldn't mind leaning to your left side. Yes. So this is the perfect spot, which is about the 5th intercostal space left mid-clavicular line. So you feel for it. And we're good. You can lay down. Thank you. Now we're going to talk into the other pulses. We're going to feel her temporal pulses. And feel her carotids. There might be some laughter involved. We're going to feel radials. Brachial. Femoral, you feel up in here. Popliteal. Posterior tibialis. Oh, thank you very much. And then dorsal pedis. Now we're going to auscultate some 5 spots on her heart. First using the diaphragm and then using the bell to look for any adventitious sounds. So we start with that same spot, the mitral area. We move up to Earth's point. Then we move up to the tricuspid. Then the aortic. Then the pulmonic. And then we go over to the right and we feel the aortic. Then we'll repeat all of that with the bell. Now we want to assess for any whooshes sort of in her arteries to make sure that there aren't any bruits. Start with the temporal. Go to carotid. All sounding lovely. The aorta. We also want to listen to her renal arteries. We'll listen in her groin. If they were in a John unit look, it'd be right about the underwear line. Then we'd want to listen to femoral. And then we're good. The last thing we want to do is check for capillary refill. Do that with the fingers. And you can also check with the toes. Your feet are cold. Alright, now to do the abdominal examination, we're going to put the bed flat and try not to hurt ourselves in the process. You may want to sit up for that one. There we go. Okay. So we do the order of things a little differently with the abdomen because we want to listen before we start moving things around. So if Brittany were in a Johnny, we would sort of just clear enough so that we could look just at her abdomen. We'll look for the contour, look for symmetry, look for any sort of bulges that might be there. So first, with the diaphragm, starting in the right lower quadrant, we're going to listen 15 seconds, usually to hear some popping sounds. You did a great job of not laughing. Not such a great job. Okay. Now that we've listened, we sort of manipulate things a little bit. We can start with percussion. Again, starting in the same right lower quadrant, in a zigzag pattern, we're going to check 3 spots in each quadrant. Should be hearing a combination of resonance and dullness. actually tympany and dullness, because think about it, most of our intestines are either filled with like digested food or air. Another thing we can percuss for is the spleen. Normally, you can't really percuss it unless it's enlarged. So we start at about the 6th intercostal space, the 6th rib, right along the margin, the axillary line, and we percuss down. Not really going to hear much of anything because Brittany's not having any issues with her spleen. Next, we're going to move on to light palpation. Purpose of that is just to see if you elicit any sort of like tenderness or if there's any discomfort. So you in a very gentle gliding manner, trying not to tickle the patient, and you just gently feel around in each quadrant. Deep palpation we're not going to show, but that's more to look for like masses or something like that. Also in deep palpation you can feel for a few of the organs. You can't always feel them. For the liver, there are a couple different ways you can do it. You can take your left hand along sort of like the area of the 11th and 12th rib and sort of just lift. And then you try to go way below where you think the margin of the liver would be. And you just wait on inspiration and see if you can feel it, sort of just trying to glide your hand in there. Another way that you can do it, especially if the patient's lethargic, is take both your hands and sort of hook it in and try to feel the liver on inspiration. Sometimes it works. For the spleen, you take your left hand along the level of the 5th and 6th rib, you lift. Every time you do this, you're sort of just trying to bring the organ closer to the surface. So you lift. With your right hand, you want to make sure you're way below the costal margin. Inspiration, you sort of just try to glide in there and see if you can feel it. Doesn't always happen. And the last thing you try to feel for is the kidneys. The right kidney is the one you're more likely to feel, but kind of both a little unlikely. So you stick your left hand on the level of the 11th and 12th rib, and you want to go all the way over to the costovertebral angle and just, again, lift it. You're trying to get the kidney up there. With your right hand, you're sort of trying to trap it during inspiration. And you do the same on the other side. Like I said, if any kidneys are involved, it would be the right one, but it's not always. And that finishes up our exam of the abdomen. So we're going to get back to some range of motions. Brittany, if you could bring your knees to your chest. Perfect. And bring it back down. And if you wouldn't mind sitting with your legs dangling. Push this back a little. I want you to extend your legs, so kick them out. Perfect. Do that again. I'm going to test for your strength. Perfect. And the last joint we want to check is the foot. Let's park you down here for a minute. Also, while we're down here, we can look for any discoloring, swelling, just like we would do for her arms while we were inspecting their range of motion. All right, so I want you to pretend you're touching the gas pedal. Lift it up. Move your feet outward, inward. Wiggle your toes. Perfect. Push on my feet. Perfect. Push away. Push in. Lovely. Okay. I'll bring you back up. I'm going to have you stand. You can put your socks back on. Let me get your socks. I can't say I agree with that one. Okay. So first of all, stand up. I want you to bend forward. Bend back. Bend to the right. Bend to the left. And just sort of twist. Perfect. And just now, we're going to test your mobility a little bit. So if you wouldn't mind just walking. Here we're looking for some symmetry in our steps and balance. Steady, even steps. That's good. Okay. Now come back walking heel to toe. And now walk on your heels. And can you turn around and walk on your heels a little bit more? Perfect. And walk on your toes. No, keep going that way. Perfect. Now you can just walk normal. All right, so that concludes our exam. Do you have any questions? Perfect. Thank you for being such a good patient.